Hello, everyone, and welcome to Intersections Online, where Ryerson experts share their work and perspectives on topics that matter to all of our alumni and friends. My name is Christian Mehta, and I am the AVP of Engagement at the university. Before I introduce our moderator today, I want to pay my respects to the Indigenous peoples, elders, and ancestors who stewarded and cared for the nature and people who lived on the land that was taken from them and where Ryerson is located today. At the university, we have made important commitments to reconciliation and decolonization, and I invite you to learn more about this work online and in person next time we can get together on campus, which I hope will be in 2021. Before we begin, a couple of really quick reminders. One, this session is being recorded, so you can rewatch it and share it with anyone. Later on, you'll get an email with a link, so please do check that out. And two, if you have a question for the panel, please type it into the Q&A section of Zoom. So this week marks a somber anniversary. Monday was a year since the first positive case of COVID-19 was identified in Canada. Since then, thousands have died, thousands more have fallen ill, and it wasn't until the approval of 2 vaccines last month that any of us saw a light at the end of the tunnel. Today, we'll explore what vaccinations mean in a post-pandemic world. And we are very fortunate to have Dr. David Cram, Dean of Ryerson's Faculty of Science, to lead the discussion. Dr. Cram joined Ryerson from the University of Calgary in 2018. He has spearheaded the development of a cluster of excellence in discipline-based education research, as well as catalyzing the creation of a new cyber studies program to be launched in the near future. As a response to the pandemic, he established RAIL, Ryerson Augmented Learning Experience, together with Paul Duffy, a Ryerson alum and president of Next Tech AR Solutions. A true believer in innovative collaboration, Dr. Cram has led cross-disciplinary teams in science, medicine, engineering, education, and the arts, along with industrial partners and practicing clinicians. His creative academic approach translates into his passion for music as well. Dr. Cram, it's over to you.
Thanks, Christian. Really looking forward to today, and I want to also do honor to the traditional lands. I'm broadcasting out of Calgary today, so I'm fortunate to be on the Blackfoot lands, and I love the fact that that I'm permitted to be here with grace. So I'd like to take a moment to introduce our panelists, awesome people, all 3 of them from all over the planet, which is a really cool happenstance that we have online here today. So the first one is Dara Akarawuzi. She is in England right now, and she's a Ryerson alum. So she began her clinical research journey while still a biomedical sciences student here at Ryerson. When she assisted with clinical health research in the Division of Rheumatology at Sick Kids Hospital. After graduation, not so long ago, June 2020, Dara was invited to work with the University of Oxford's Jenner Institute and Oxford Vaccine Group to assist with the development of the AstraZeneca Oxford University vaccine trial. Dara is currently a clinical trial coordinator for the Summit study, the largest lung cancer screening program in the UK, supported by University College London Hospital's NHS Biomedical Research Centre. So welcome, Dara.
Thank you for having me.
Next on our panel is Amina Coulter. She's in Georgia, USA. She's the Vice President on the Health and Multicultural Communications team in Edelman's Atlanta office. Amina has extensive experience in healthcare public relations, providing strategic counsel to pharmaceutical, medical device, and diagnostic and health and wellness companies. She oversees the development and implementation of integrated healthcare communications campaigns, targeting both clinicians and consumers. She earned a Bachelor of Arts in Communications with a minor in Public Health from George Washington University in Washington, D.C. Welcome to the show, Amina.
Thank you.
And finally, from Toronto, Dr. Michael Finkelstein. He was raised in Ottawa and completed undergrad degrees in organic chemistry, so a fellow chemist, cheers to that, and biochemistry before entering the University of Ottawa's med school. Michael interned in Ottawa at both campuses of the Ottawa Hospital before moving to Toronto to complete specialty training in public health and preventative medicine. While completing his specialty training, Michael completed a master's degree in epidemiology at the University of Toronto, and he joined the Toronto Public Health as an associate medical officer of health in July 2001. Since then, he's assisted Toronto Public Health in its response to 2003 SARS, the arrival of the West Nile virus in 2002, a large Legionnaires outbreak in a nursing home in 2005, spent 2007 on secondment at Cancer Care Ontario supporting an introduction of the HPV vaccine, and led the response to a large measles outbreak in 2008. Michael's current focus is on the planning of the COVID-19 vaccine campaign for the City of Toronto, which is much needed. Welcome, Michael. So I think we'll get right to some questions, and I think it's almost impossible to imagine anyone not having been touched by COVID-19 in one way or the other. The fact that we're all online leads to that. But I'd like to go around the panel and just ask you first your personal experience with COVID. And maybe we'll start with Dara because she has a timely story to tell us about this. So over to you, Dara.
Yes, so today I found out that I tested positive for coronavirus. And it's kind of surreal to think about because this time last year, it seemed like something that was so distant. And then over time, you started to hear about friends of friends who had coronavirus, and then friends who had coronavirus, and then now I have coronavirus. And I guess I'm just really fortunate that I was able to get tested, and the NHS has a great test and trace system here. So, but coronavirus again, it's really affecting our daily lives, and I'm really hoping that with this vaccine we can go back to a normal or a new normal and start to enjoy the things that we once enjoyed.
Thanks, Dara, and continued mild symptoms to you. Over to you, Amina, your personal experience with COVID.
Sure. So like many others on this panel and a part of this discussion, my family has been personally impacted by COVID. My grandmother actually just recovered from it, but we've lost a number of loved ones to the disease over the past year. So that has really ignited my passion for communications and really ensuring that our clients can create communications tools that really address the health equity issue here and ensure that we have access to testing, to screening, and now to the actual vaccine. So I'm excited to be a part of this discussion today.
Thanks, Amina, and sorry for your loss, and those of anybody out there that has felt that. It really is tragic, and let's not lose sight of that. Over to you, Michael. Personal experience with COVID.
Thank you. So the last year has certainly been a professional a challenge to me and the people that I work with. And some of the things that have personally guided me is to maintaining an open mind. A lot of learning has occurred in a very short amount of time in my profession as we've engaged in the response to the worst pandemic of our career. And so maintaining an open mind so that all possible solutions for problems that are put before us are debated and investigated. That life is not a straight line. So this, in the last year, there's been a lot of things that have occurred that have changed the direction of the response, and that I've had to use all the skills that I've learned over the last 19 years practicing public health here, because this has been a challenge to my colleagues and myself that we have not experienced in the past.
Yeah, thanks, Michael. Thanks, everyone. Reflecting back on the year, I remember sitting here in Calgary with my family after the break, and we were kind of almost scoffing at COVID. It wasn't declared a pandemic yet. It was, it's just another, wintertime sickness kind of thing. And things just evolved so rapidly to WHO declaring pandemic and then following the infection rates. It's been really trippy. And it actually changed the direction of our research. We are trying to, through nanomaterials, develop an artificial virus now, and we didn't have a sniff of anything like that before the pandemic. I think it's not totally glib to imagine that this is a really tough time for humanity, but there are silver linings that we're getting out of this, and I try to keep the focus on that as well. But there are some really tough questions, and I think like this panel is well suited to have some discussions about those. So I'll toss one out there right now. It kind of starts from an Alberta perspective, but I'm sure this perspective is not unique to Alberta. And it's about deployment challenges and opportunities. So for example, at least when we were developing these questions, only about 50% of people in Alberta said they'd take the vaccine. And that certainly doesn't feel like it's going to lead to herd immunity. And so the question is it ethical to force people to take it? In elementary schools, there are a number of vaccines that you're essentially forced to take. And how would this forcing affect those with fewer means? That making people take it doesn't mean they have the capability to do so. And, like from a Star Trek point of view, the quote is often the needs of the many outstrip the needs of the few. So it feels like it's an honest ethical question. Like, we want the best for humanity, but can we force them to take a vaccine? I don't know, who would like to have a first go at that? Amina, maybe?
Jump in.
Yeah.
I would say the pandemic has shown us two things. So first, essential workers, communities of color, and rural communities are disproportionately affected by the pandemic and have had more severe outcomes. And these are also the same groups that don't have the same access to pharmacies and health systems and health facilities. So while vaccine hesitancy has to be addressed, it's not going to happen overnight, and it's not going to happen in just a few weeks. We really have to build trust with these communities to ensure that they have the resources and information to make that informed decision. So, Edelman recently launched our new cut of our trust data. We're considered the House of Trust. So over the past 20 years, we've been creating data to really inform our clients and our business imperatives. And the recent cut highlights that a third of people are still saying they might not get the vaccine at all. And another third are saying they may get it in 6 months to a year. And it really shows how people are feeling and the questions they're having about how quick the vaccine was created. And so I think we have to look at vaccine hesitancy at face value and really dig a little bit deeper. There are historical transgressions. There's been a lot of misinformation that continues to contribute to why people are hesitant about adoption. So I think it really starts with building trust with these communities, making sure that they can make their own informed decisions, and aren't feeling like we're forcing them to do something, but that we're giving them the resources to really inform them and make the best decision for their families.
Thanks, Amina. Great points. Yeah, and one of the questions in the audience was like a question of why people are hesitant. So I think you touched on that as well. I know, Michael, do you have any thoughts about this? And then we'll bounce over to Dara as well.
So I would certainly agree with Amina that we do need to build that trust. We have seen in data that we've collected that there is a fair gap between racialized populations in Toronto and the general public in their interest in being vaccinated. So we have a road to climb there, and that we need to build that trust. And we're building out ways of doing that. We're engaging with community leaders, people who are in these communities, who we can feed or we can build the information that they have so that they can in turn work with their communities to build that information and knowledge of the vaccine. And then, as Amina said, to also support easy access, because it is both an interest in taking it and the availability and access that we have to create in these populations. So certainly we are working very hard with our racialized, marginalized populations to build the knowledge with community leaders who know their communities best and can take that up. Also, I do want to point out that since the vaccines have been licensed and are now being used in Toronto, and we're starting to vaccinate people, recent polls have shown that people's interest in taking the vaccine is increasing. And so that's good to see that they're seeing the vaccine is safe, and hopefully in the next couple of weeks we'll start to show some effectiveness. We still don't have enough people who have been vaccinated to really show that, and my panelists from the UK might want to comment on that, where they've had more people vaccinated. But we're hoping to show that. And so that will build even more confidence in our population across different communities, and so that people will then take us up on our offer of the vaccine.
Thanks, Michael. Yeah, Dara, what's the vibe in the UK with respect to hesitancy and what might be driving that?
Yeah, so there was a recent statistic that 72% of people of color would not take the vaccine. And I think this all really does come down to education and educating people about the vaccine, because we live in the time of social media now. And even my grandmother is on Instagram, and she'll send me, those little posts on Instagram, which aren't like factually correct, but when we spend most of our time there, that's where we get all of our information. So providing a different way to get information is definitely also really important.
Yeah, thanks, Dara. And I've had my own moment of hesitancy as well. I fully, as a scientist, believe in the science that led to the development of these vaccines, and I think that the advances are super cool. But I had a moment of like, does this mRNA integrate with my own genome? Like, am I going to become part COVID, like some sort of hybrid entity? And then I actually allowed myself to think a little bit deeper than that about it, and realized that that is not the case, that this process does actually kick my immune system to get ready for COVID. But people who are left to their own devices to think about things, like even a dean of science might have some thoughts that lead them to be a little bit hesitant. And I agree, Dara, like the education is so important. And as much of a vehicle for misinformation social media can be, it can also be a medium for correct information. And I think that's why it's up to folks like us to keep telling the great stories about what's as close to the honest truth as science lets you get under these conditions. So let's maybe transition.
But I also think though, I also think that social media is one platform, but I do think that that interaction with community, with people in your community, it can also be a huge support to getting the word out.
Yeah, absolutely. It's our mission, our outreach mission, to keep talking with our communities. So in a large city, I'm sure there are unique challenges, and Toronto being one of those, London and Atlanta also very large cities. Um,
Very large.
so, like if we're thinking about deployment, of homeless populations, as folks that, may not be getting the same capacity to be vaccinated, and how does all this start to, work around our estimate of when herd immunity would kick in a larger city. And maybe we'll start with Michael on that one, and then jump over to Amina and finish with, and then go to Dara on this one. So the large city thing.
So, infectious diseases do have a long history of circulating in large cities. So, in the history of public health is in some ways built on the circulation of infectious diseases in cities and ways of controlling them, even going back to the foundations of my specialty in places like London, where Dara is. And so this is a challenge for all public health practitioners in large cities, homeless individuals, and that community being one challenge. But we've seen recently, the challenges of getting people to work on public transit, or the importance of, or the need for certain subpopulations to go to work because that they can't work from home. And so these are all components of the challenges of public health control of infectious diseases in built up areas. And certainly the homeless population is an important community that we need to be mindful of. Each year, for instance, Toronto Public Health supports influenza vaccination in this population because it's important for them to be protected. And so that's one template or one past way of ensuring that this population does get vaccinated. We're working with hospital and other partners in our community to plan out the strategy for the homeless population so that we can be ready when the vaccine is available in quantities that are sufficient to start that part of the campaign. But it's certainly on our mind, and we are beginning to plan for that part of the campaign.
Yeah, and just to build on that, I think there's sort of three challenges, right? So misinformation is first and foremost, and it's really threatening our pandemic recovery. Access being number two, and that's for people of color, that's for homeless population, that's for rural communities. And then 3, 4, 5, and 6 are mistrust, and it continues to be based on historical transgressions, but also just modern medicine. In the Black community specifically, Black maternal mortality rates are still really high. So that point of entry into the health system is already a struggle. And so people are scared before even gathering information and insight around the vaccine. I think, clinicians, pharmaceutical companies, and even the government, we have to give people the power to protect themselves and their families. And it's not protect the greater good, but it's really, what is this going to mean for me and my family? And I think a lot of times, like, our opinions and our experiences are really based on, relationships. And so when we see someone, when we hear from someone that looks like us or is part of our family, we're more likely to listen if they have good news about the vaccine or if they've had a good experience. So I think we really have to think about giving people, empowering people to gather information and hear from the folks that are nearest and dearest to them. And I think clinicians also really have to listen to the concerns. They're valid. And I think being able to really connect the dots between hesitancy and how we can address that is really going to be key.
Thanks, Amina. Over to you, Dara.
Yeah, and just to add on to that, what we're seeing in the UK is discussion about what actually makes a vulnerable group. That's how we prioritize who gets the vaccine. So right now we're seeing that people over the age of 80, people who work in healthcare homes and health settings are the priority. But then it begs the question of, what about our police officers? What about our teachers? What about the people that work in grocery stores? These are still people who are quite vulnerable, but are not on the priority list, as well as people of color who are actually 4 times more likely to die from coronavirus. We're also not seeing these people on the priority list. So I think around deployment, it's really defining what makes a vulnerable group and how do we make them a priority.
Yeah, great point. Looked like Amina wanted to.
Oh, I was just going to say, like, I do think herd immunity is possible, but I think it's going to require us to really create trust, make it easy to sign up and actually receive the vaccine. And then when people do sign up and show up for that vaccine, making sure that they have a really good experience, because then they'll go and tell their friends and their family that no one wants to get a shot, but if they have a good experience with the nurse or physician, they're more likely to have others catch on.
Yeah, word of mouth is so powerful. You know, whether that's through masks, person to person, or via social media, for sure. So we're kind of trending a little bit towards this idea of how rollout might happen, and a great number of the people in our audience right now are from Toronto. And so we're getting a direct question to Michael about what the rollout plan actually looks like for Toronto. And then I guess if Amina or Dara had any experience with rollout plans in your cities to compare to what Michael's about to tell us with respect to Toronto.
Thanks, David. So at a high level, Toronto Public Health is part of a wider provincial rollout of the vaccine. We're using 2 licensed vaccines, one from Moderna, one from Pfizer, which the audience might be aware of. And right now, we're really focusing on that highest of high risk residents and the staff and essential caregivers in long-term care and retirement homes, because we've had the most illness and unfortunately the most death in this environment. And at the same time, as Dara indicated, we're also vaccinating healthcare workers who have direct patient care experience. And so right now we're really focused with the limited vaccine doses that we have on those populations. Afterwards, the phase 1 of the rollout from the province's direction is to focus on Indigenous populations, because we know they're marginalized, at greater risk, and adults in our community who are receiving chronic home care, because they're the frailest of frail elderly individuals in our community. And then we're going to move on to phase 2. The provincial government has not yet released really the details about phase 2. We are going to focus on essential workers, like Dara indicated, and then we're going to move on to the community. And so at that point, hopefully we will have sufficient vaccination to really begin a wider distribution of or administration of the vaccine. And then I'm going to certainly agree with Amina that when that rollout starts to begin at that scale, we have to make the experience as positive as possible, so people are easily registered and get appointments, so that they are not waiting in line, so they can quickly come in, receive their vaccination, and get an appointment for the second one, all in one seamless and hopefully a pleasant experience. And so the details of the phase 2, where most people are going to get vaccinated, we're just building those details now as we determine when the vaccine is going to be available for that wider population group.
Thanks, Michael. So not going to hang an actual date on that one yet, though. Hey, I know there's modelers out there that are saying like May to July or whatever, but it's probably too soon to know for sure. Amina, similar experience in Atlanta?
Yeah, I mean, there are articles saying about a third of the US has been vaccinated to date, but the challenge is the other 2/3 are hesitant. So I think we're seeing an influx and more people are getting vaccinated. But to your point earlier, it's about word of mouth. It's about making sure that people can access the information and sign up and get in and get out and have a good experience. So it is improving, and I think we all kind of have to be patient. I think it really is a timing issue, and so we'll see rollout get better. I think over the next few months.
Yeah, thanks. And it makes you wonder, like general population, whether, that will be by appointment, because you can imagine huge lineups kind of like occurred in the testing part of it. And we had to transition to by appointment just so that people weren't in a lineup for hours on end. Dara, like what's it like for vaccination in and around London right now?
So the UK has vaccinated about 6.5 million people now, and aims to vaccinate all adults, or aims to start vaccinating all adults by autumn of this year. So we're really seeing that there is a high intake of vaccines, but it's again just that people of color who are not interested in getting the vaccine, again just because of all of the issues that Amina spoke about. So again, it's really important that when their time does come, that we have the resources, because they're 4 times more likely to die from coronavirus. And I even read today that Black people over the age of 80 are only 23% likely to get the vaccine, while as white people over the age of 80 are 43% more likely to get the vaccine. So again, it's really about encouraging and educating those communities.
Yeah, 100%. So let's shift a little bit because there is a population for which there's no plan to vaccinate right now because children, have not been involved in clinical trials, and that's for very good reasons. But there is, like we talk about the school system and whether those are hotspots for transmission of COVID, and I guess like in the natural course of vaccine development and deployment, kids do come into the mix. But under the current circumstances, what are the plans, and do we have any insight in what's happening with kids? And maybe I'll bounce over to Dara to start with on that one.
So here in the UK, I haven't heard anything about vaccinating children, just because there isn't exactly a vaccine trial for children right now that I'm aware of. And I think this is mainly because children aren't seen as the super spreaders or likely to get the virus. But it's really interesting because when most children go to school, and that's where they mix with different households and mix with their teachers, and you have a classroom full of 30 children. So I'm interested to find out when children will be vaccinated.
Over to Michael on that one, and then Amina.
So some of the major pharmaceutical companies have begun to enroll small numbers of children in follow-up trials on children. So those have begun with small numbers I am aware of. And it's going to take some time before we can determine the how effective the vaccines are in younger individuals. Normally, we don't see much difference between adults and children, but certainly it is important to get that data so that we can confirm the safety and efficacy in children, because they do have different physiology, and so it is important to do that, because I think while Dara's right, they haven't shown much super spreader potential. They are members of our community. And so to support that wider prevention of mortality and illness, we are going to have to engage them in vaccination at some point. And I am hoping by that time, we will have the evidence that shows that the vaccine is effective in this population, and so that we can add them to the mixture. Because I think from parents' perspective, they're going to want to see the proof that this is going to work in their children before they're going to sign up. The hesitancy for individuals is there, but there certainly is, that extra step about exposing your children to this. And so we're going to need to be able to present that evidence and that safety evidence to parents, so that they're willing or accepting of getting their children vaccinated. And so that's one part. From a herd immunity perspective, certainly, as Dar said, we want to focus on places where we can prevent the most illness and death. And so that's why we're starting in Toronto and in other places, Ontario, long-term care homes, retirement homes, because we know that there's been that substantial illness and death in those, unfortunately, in those environments. And I'm hoping, I don't know the timing of that, but I'm hoping sometime this year that we will have additional evidence for that group students, so that we can get the vaccine to them. In the meantime, it is important to continue with the public health measures that we've had in place for schools, so that we can decrease the risk of the virus circulating in children. So masking, making sure that that distancing in the classroom occurs, making sure everybody is screened before they go to school in the morning, so we can detect people who might have illness. These have shown to certainly decrease the risk of the virus circulating in places, as Daras said, where children come together.
Thanks,
and
Michael.
I'll leave the clinical side of things to Dara and Michael, but I'll say from a communications perspective, having the vaccine issued to children is going to be an added challenge for communities of color, because we can't even get the parents or the grandparents vaccinated just yet. So I think we have to ensure that pharmaceutical companies, the government, and clinicians really think about sort of three communications imperatives. And I would say one, ensuring that their organizations are committed to being a reliable and accessible source for vaccine education and information. I think it's also building those partnerships that Michael and Dara mentioned earlier. We have to be in the community. We have to call on community leaders to share messaging, to dispel myths, and really help with vaccine adoption. And then three, I think it's the tailored, personalized care. So providing culturally competent messaging and communications in those communities that really dive into why your child should be vaccinated, why you should be vaccinated, and ensuring that we're not just casting a wide net, but we're being really personalized and targeted.
Yeah, absolutely. I think that this has been fascinating, because in some ways it feels like a grand experiment that Mother Nature is doing on the human race right now on so many different dimensions. And we have, as vaccination evolves, we'll have pockets of stats to see how it's going. And we'll probably have pockets of populations that aren't vaccinated, and from a scientific point of view, that's kind of like a control experiment. And I always find it amazing that even given all of this evidence, people are still hesitant. And that's really, maybe some people will only listen to their friends who have gone through the process and found it to be okay. And and kids are vulnerable. So I can see why parents may not want to completely trust the system. And if they have a kind of predisposition not to trust government to begin with, and this is a government program, then I certainly see where it comes from. So that there's questions flying in.
Just wanted to jump in here.
Yeah.
Just want to jump in. I think it's important to just be mindful of the fact that the vast majority of parents in our community in Toronto do get their children vaccinated. The number of people who decline our mandated vaccines in the school system is pretty small. And so we have seen that when we provide the information that parents need, the vast majority of them do get their children vaccinated. So it's an important point to make.
Yeah, exactly. We could go in a million different directions right now, based on the questions that are coming in from the audience. So that's great to see that level of engagement. We probably won't get to everybody's questions, so apologies in advance if we don't get to the question. That doesn't mean that it's not an important question. It just means that the random access to David Cram's brain is bandwidth limited at this point. There was one question from a scientific point of view. Maybe I'll try and pick that one off, and then we'll get to a really interesting ethical question of, like, once vaccinated, would we have vaccination cards, for example? But people are interested when I'd mentioned that the vaccine boosts your immune system, and like how does that actually work? So let me have a quick go at that. And if somebody thinks that I'm like way off, then please correct me while you can. But basically, the vaccines encourage those that are vaccinated, their bodies to produce part of the virus. And in particular, I think everybody's seen that picture of the sphere with the spiky bits sticking out. So those spike proteins, and that's foreign to the body. And that actually encourages your immune system to build up defenses against that specific protein, which is how your body recognizes the virus. And so you aren't being vaccinated with anything that would produce a live virus. That needs to be like abundantly clear to people. They're not getting the virus itself, but some small part of it that encourages the immune system to kick in and get ready, such that when you do get the virus, your immune system's ready to fight for it. Is that okay? Does that seem like a reasonable explanation? Okay. Okay, so one of the very interesting questions came up, and I think it's been in people's minds. So, like, let's say we get to 60% vaccination or above, and folks are starting to then wonder about going to a movie or a concert or something like that, and to have a safe population. What's the ethical side of having people, for example, carry vaccine cards? I mean, it kind of sounds Orwellian. But how do you know when somebody's been vaccinated when we're not quite at herd immunity yet? But maybe we want to get folks back to school, or out able to go to weddings. And like, what are folks' thoughts on the panel about proof of vaccination? I guess is what the question was getting at. Dara, any thoughts on that? We'll start with you.
I think at this time, really anything to just keep the population safe is really going to be important. I know that before you take a flight, you have to produce a negative PCR test, and that's really just to make everyone safe. So I think the idea of these vaccine passports, they don't seem too far off. Just when people are traveling across the country, even to go to Nigeria, which is my hometown, you need yellow fever. You need to be able to you need to be able to prove that you've had your vaccine, just in case you're bringing it into that country. So I think it's really important, and I think anything really at this time to just keep the population safe and to keep levels down. I would agree with.
Yeah, yeah, I agree with that too. Amina, like, I know down in the States that this feels like it could be a triggering kind of thing. It dips into personal privacy and all those issues. You got a feeling, a reaction to?
Yeah, I think we would certainly have to be careful on that front. We're towing a fine line. But I think even once people are vaccinated, we still need to be safe. So wearing your mask, social distancing, washing your hands, even after folks get vaccinated over the next few months, we still need to adhere to some of those guidelines to make sure we keep each other safe.
Yeah, great point. Michael, your thoughts on the so-called vaccine passport. Maybe it's more for travel rather than events. Any thoughts?
I think Amina raised the point I was going to raise, is that we really don't know yet the vaccine's impact on transmissibility, like the ability for people to pass the virus to each other once they've been vaccinated. And this is something we're going to find out over time as more and more people get vaccinated. Does it impact the circulation of the virus in the populations where vaccinations is very common, which is what something, David, you said earlier about these pockets, these natural experiments that were going to occur over the next 6 months as various communities become more and more vaccinated. Because your discussion around 60%, 70%, that's undoubtedly going to be a collection of communities where it's very high in vaccination, maybe 70, 80% or more, and areas where it's much lower. And so it'll be important to take a look at, did the vaccine in that community where it's 70, 80%, did the virus die out in that area? And then we can infer that perhaps it is influencing your ability to transmit or to pass along the virus to others. And that would have an impact on my thoughts around proof of vaccination, because then we can link your vaccine status with your ability to transmit the virus, and that has different implications for our decisions around these passports or a proof of vaccination. But it's important to note that there will be a certain number of people in our community who can't be vaccinated, and we shouldn't penalize them as well. And so we have to balance the importance of being able to reduce the measures that are restrictions that are in now once people become vaccinated, also with that fairness about our population, because some people are not going to be able to be vaccinated. So we need a bit more information before we're really able to effectively answer the questions that you posed.
Yeah, agreed. And the kids do have their update cards for measles, mumps, rubella, and like that sort of thing. And there is so much, like, decades of history of the efficacy of those vaccines. And certainly where there are pockets of folks that don't believe in that system, not surprisingly, there are outbreaks of measles. So yeah, I mean, it's a fascinating ethical question for sure. And all we want to do is get to a point where people are safe, and especially those that are vulnerable. So like, maybe we didn't go too much into like how we address homeless population, for example. On my way to work at Ryerson every day when I was walking in, I walk right past a group of homeless folks, and you kind of get to know them a little bit, but they're transient, like they're not always there in the same place. Like how do we address vaccination for the homeless? And I think, Michael, Toronto's got a fair sized homeless population. Are there plans for getting those folks vaccinated?
Yes, we are certainly getting those plans ready. Again, using the past experience with the flu shot, we found very good interaction with our shelter system. Lots of people who are homeless do want to take us up on our offer of the flu vaccine each year. So we certainly do see in the past that this population is interested in vaccination, if it's available and accessible to them. And so that's part of our plans. As Amina said, we also have that information available to them, and that in many instances, as you said, David, it means coming to them. And because our homeless population is spread out in our community, and so one of the things that we have to consider is how do we engage the homeless population where they are, out in encampments, in parks, in the traditional shelter system. So these are all places which we have to consider, and we are, about ways of allowing homeless populations to interact with health professionals so that they can get the information they need to decide to get vaccinated. And then we're up against another challenge, unless we get a different vaccine on the market. Right now we have a 2-dose vaccine. So not only do we have to engage the population to accept the vaccine once, but we then have to go back at a certain amount of time afterwards and do it all over again. And so that that also has implications for hurdles that we have to consider. And perhaps we know that one of the vaccines that's in trial right now, the Johnson and Johnson vaccine, is only a single dose vaccine. We are expecting a trial data to come out relatively soon, we hope, about the phase 3 trial on the that vaccine. And that vaccine only needs one dose. So maybe it is this population that we use that vaccine on, if it proves to be efficacious, because that would certainly make it much easier to cover this population. But we know that we're going to have to take the vaccine to this population just because they're so spread out in our environment. And we also know that they are going to need the information that they need to build that trust to receive the vaccine.
I mean,
Yeah,
anything
I would just add to that, our goal shouldn't be to force these communities to take the vaccine, but instead ensuring that we're providing them with the knowledge, with the information to make that informed decision for themselves, for their families. And that goes for the homeless population, that goes for rural communities, that goes for communities of color and essential workers.
Yeah, great point, because there probably is a sense out there that government could force people, and that is not the intention at all. Dara?
Yes, I agree. Like I said in the beginning, I think it's really important to make sure that people are educated so they can make an informed decision whether this is something that they want to do. I don't think by any means we should be forcing people to take vaccines, but provide them with the information that they need, and hopefully then they can make a decision.
Yeah, and there may be natural places to do things like that, like needle exchanges, for example, could help. And again, like it is a super vulnerable population, and trying to provide them with the best information for their situations, their individual situations, to make good decisions. I think we want everybody to have agency in this vaccination protocol. And make decisions based on evidence as best we can, for sure. I think we're a few minutes left, and maybe I'll go around the horn with everybody as a kind of like wrapping things up for your final thoughts, and maybe in the spirit of predictions, maybe predict from your experience when we'll be out of this funky situation. Dara, maybe we'll start with you.
Well, that's since this pandemic started early last year, I personally thought it was going to last a month or two, and then we rolled into 2021. So as far as a prediction goes, I'm hopeful that we have our vaccine program going here. We're starting to vaccinate the vulnerable. And it's estimated that the vulnerable populations, or the over 80s, will be vaccinated by mid-February, and that the rest of the adults will be vaccinated by autumn, so October time. So as far as a prediction goes, I'm hoping we won't roll into 2022 with this virus.
Amina, your thoughts for south of the border from Canada?
I think, again, as I said earlier, it's really about giving people the power to protect their communities. And I think we have to think about vaccine rollout like a consumer product or service, where we really have to personalize and target individually various communities, because it's not a one size fits all. And I think in doing that, we'll be able to bring this pandemic to an end.
Yeah, thanks. And Michael, I'm sure like our audience is waiting on bated breath for your guess as to when life's going to return to the new normal in Toronto.
First, I really have to, as David, you started out with at the start with the reference to science, and we really have to tip our hat to people like Dara and her team in London and other science-based organizations that have brought us here in unbelievable time. Really amazing scientific discoveries over the last 10 months, which have gone from a virus that really was unknown to one that's now vaccine preventable in about less than a year is truly remarkable, and we should stop and just think about how remarkable that is in our ability to control this terrible virus in such short amount of time is just astounding. So that's important to be aware of. I mean, I think from a looking at the knowledge that I have right now, I think it's probably going to take through the summertime in Toronto before people have gotten a vaccine sufficient to build up that immunity in our population that we can take a step back from the measures which are in place. I think that's really built on an estimate of the vaccine availability between now and say June or July, when everybody who wants one will probably have access to the first dose. But it's important to note that there are vaccines that are in development that may change that time frame and may accelerate it if those vaccines prove to be just as efficacious as the ones that we are using now. So we can all cross our fingers, because certainly those may have an impact on the timing. But I think looking at the provincial plans, hoping that or anticipating sufficient vaccination to begin widespread vaccinations in the April-May timeframe, when we're going to have sufficient vaccine to really have large clinics where people can come and be vaccinated. But then it's going to take some time to get through the population, and so I'm hoping sometime in late summer that we can we'll have a sufficient herd immunity. But as Amina said a number of times, one size is not going to fit all. Within that time frame, there's going to be subpopulations who are going to have to respond to their unique needs in the wider campaign, and we're thinking about that now, because it is actually not one size fits all. And so from here, I'm very optimistic that we're in the beginning of an important campaign that should last between now and summertime.
Thanks, Michael. Yeah, so we're coming up on our time. It's been awesome and fascinating. Really enjoyed our conversations. Like I'm sure we're all feeling, I wish we could have done this like in person, but on the other hand, we're hitting like all points, many points on the globe right now, which is really cool as well. My perspective kicking off, like those of us that are in these incredible positions of privilege, should continue to lend our support to those that aren't, and support people, and not just in getting the vaccine, but in safe practice as well. Like we can really help prevent the spread by, putting our shoulder to the wall and pushing hard on keeping those masks on and keeping socially distanced. And I know it's brutal, but it's starting to feel like the end is getting near, which is great. So thanks, Dara, Amina, and Michael, and thanks to all our alumni that are out there, making this thing happen and, being great contributors and friends of Ryerson. We really appreciate and love that you're willing to take an hour out of your existence and listen to some great people talk about some really fun things. So I'll bounce it back over to Christian to wrap it up for us and say, like, have a safe rest of the week, everybody, and hopefully see you soon.
That's great. And yeah, just to echo what David just said, thank you to all of you for your insights, perspectives, leadership. It's been an incredible discussion. And David, you're an excellent moderator. Thank you for your time on this as well. Appreciate that on behalf of all of our alumni. To all of you who've tuned in, thank you. This means so much to all of us to have the support and encouragement from our alumni and friends. And we are going to be sharing with you more insights on topics of interest to all of you over the coming weeks and months. In fact, tomorrow we are doing a book talk with Ryerson alumnus and journalist Ethan Liu on a book called Field Notes from a Pandemic. Some of you will have heard about it or even read it, so tune in tomorrow if you can. Easy to register on the Alumni Relations website at Ryerson. And there are a number of other events in the coming weeks that we would like to encourage you to check out on our site as well. You're going to get an email shortly with a link to this broadcast. Please do share it. This is really important information and education, as many of you have talked about throughout this presentation, to share widely. So have a great afternoon. And Dara, looking forward to good news on your recovery in the coming days as well.
Thank you.
All right. Enjoy, everyone. Bye for now.